Rachel, it is great to see you again. As we were briefly chatting, I think the last time we saw each other was in New York for the Well Building Institute panel, which you were kind enough to invite me on, and which seems like eons ago.
It sure does. And I cringe to think about how closely we hugged and how proximate we sat to one another, all through the lens of our COVID experience. Like, what a difference a pandemic makes.
Yes, what a difference it makes, and that's crummy way, because we all love hugging basically, and kind of miss that. But we are here, and I think we're going to have great things come out of this. I must say that that piece of art that you did behind you is really, really interesting. Can you give us a little view of it really quick? Move your computer.
Yeah. Let's see if I can. Now you're seeing that this is also the guest room in addition to the home office, but that is made out of dice, the kind that you use for Yahtzee or gambling or something. So when you get up close, you see that it's really pixelated, and that is an ode to my cousin who lived the 5 years after he graduated from college in this bedroom.
It's very cool. It makes you, like art should do, it makes you think about a lot of different things. And I love it. Thanks for showing it to us, and see that you're being even more productive in this time at home.
Yeah, so I'm taking out all of my restlessness on home crafting and DIY projects. So that's my solution to not going stir crazy in quarantine.
Well, there's a reason for everything, and there must have been a reason that you needed to offer that and show us other skills that you have, which look really fantastic. So thanks for sharing that. Now, would you mind just telling everybody a little bit about who you are, a little bit about yourself?
Sure. Well, for starters, I'm the president of an organization called the International Well Building Institute, or IWBI. And we are a purpose-driven organization that is committed to enhancing the places and the spaces where we live our lives into places and spaces that can enhance our health, our well-being, our performance, and our productivity. So we're best known for a certification called WELL, or the Well Building Standard. And that's a certification for buildings that enhance human health outcomes through both design and operations, as well as programs, policies, and plans. We also have a certification that operates at a community scale to address the places and spaces between the buildings, and a portfolio program that allows these approaches to be addressed across an entire organization. And just as of this week, we have debuted the Well Health Safety Rating, which by the time you listen to this will be available for anybody to sign up for. This is a pathway to WELL certification, but also a standalone rating to specifically address facilities operations and management in COVID-19 and beyond.
Yeah, I'm actually obviously very familiar with the first part of that, and I've become super familiar, thanks to our buddy Paul, with the second part of that, the health safety. So it's a tremendous timing for that. Tell me a little bit. Everybody's got their why, and some even say to me recently that they got their what, and then they figure out their why. But the question I like to ask is, why do you do what you do?
I do what I do because I think that the world needs a lot of help, or rather the people living within this world need a lot of help. And I think now more than ever, you can look around within your own community or across to the other side of the globe and see that in many ways, individuals are suffering. So in some ways, I consider myself to be an agnostic about the subject matter. Like, I have worked on education and equity and access in education. I've worked in the environment and sustainability. Now I'm working in wellness and human health. But all of my career is oriented toward trying to take the skills, the access, the opportunities, the education that I have benefited from, and apply that toward having the greatest impact that I possibly can at any given moment in my life. So, in the words of Steve Jobs, I'm fueled by this desire to put a dent in the universe and wanting to think about how to align myself with the most powerful platforms for making change and really making people's lives better and easing the suffering that I think many of us experience on lots of different levels. So maybe next time around, it'll be homelessness, you know, and affordable housing. There are just so many different ways in which we can be thinking about how we can have a healing impact on the world. I know you and I are both really into frameworks like StrengthsFinder. In StrengthsFinder, one of my top skills or strengths is competition. I really love to win. And so for me, the magic in my career happens when I take all of that energy and I apply it to winning for good.
All right. We have a term called omni-wins that we use at Fifth Element, and it doesn't stop the competitive nature of wanting to win. It just makes sure everybody wins and nobody loses. So yeah. I love that competitive spirit of you ever since the first time I met you way back when. It's awesome. You know, you certainly know this. It's taken decades almost for corporate brands to realize that aligning with social impact is actually number one required to get good talent right now, because good talent only wants to go where there's purpose. But it's really good for business. And like you said, you've been engaged in the health and wellness arena, geez, probably without even knowing it since you were a kid, my guess would be. And a focus on workplace environment and talent. So, and I always tell people this is kind of like a push question because it's about you. What differentiates you as one of the leaders who care?
Well, I think that I have an amazing access to a lot of leaders who care. So it's hard for me to think about what makes me so special from that incredible constellation of people who are making change. But I guess what I could say is that fairly early on in my career, I was able to connect with a kind of internal compass for driving forward that always leads me to my true north when I'm really paying attention. And that is to shoot for the intersection of what I'm really good at, even what I'm great at, what I'm passionate about, and what can make change. So I think for me, having that true north allows me to really navigate to positions that will be fulfilling for me and impactful for a great number of different causes that I've, you know, spread myself out across over the years. So I don't know if that makes me different, but I think that it makes me really clear-minded about how to think about the work that I do, the impact that I want to have, and how to align myself with the right organizations and people to keep journeying in that direction.
Well, you definitely differentiate yourself. I've seen it, but it's a wise answer that you gave, and it reminds me a little bit of. I've been using a lot of quotes from my grandparents and my mom these days. I guess that's good. I'm trying to figure that out. But my grandparents would always say, with a little bit of a Kiev accent, as long as you have your health, that's the most important thing, right? And then they were saying education is not far after that, but it was the health. And technology is speeding like it's never sped before. We have COVID. We've got the whole racial injustice issue and opportunity going on. But kind of like we talked with your art and some of the things you've been able to do, there's kind of been like an awakening or a time to think for people as to what is important, right? So what's your thoughts on, in terms of awareness, what the awareness we're going to have when we're at work, when we're at play, we're in our communities, that's going to happen between people?
We think about these in terms of COVID-19 silver linings. And one of the most important outcomes or shifts that we see happening is a wholehearted embracing by the modern corporation or organization that human health, taking care of nurturing the health and well-being of our employees and other stakeholders is material to a business's bottom line. Until COVID-19, we were actively debating that. And now I don't think that there's a single person who's left wondering whether the provisions that they put into place to take care of both the physical and mental well-being of their employees and of their contractors and subcontractors, anyone who's coming into their workplaces, and even community stakeholders more broadly, all of those individuals, their health and well-being have a bearing on a business's ability to survive right now, maybe even to thrive. I think that that is such a huge leap forward. And then I think at more of an individual level, the awakening for many of us is just coming to understand that public health is everyone's responsibility, that I am dependent on your actions, that a building that I'm in with you, a church, a school, a home, is only going to be as safe as the way that you are interacting with me and other people, and the way that you're interacting with the space. And so that kind of responsibility, that kind of dependency on one another and on our physical environments for their good graces, that's a vulnerability, but that's also a higher level of awareness that allow us to fine tune our environments as well as our relationships and the education of and engagement of the people around us to really find a way to collectively raise the vibration in terms of our commitment to using each of our individual power platforms and practices to advance public health on the whole. Like we've never understood that more fundamentally than this moment, I think.
I love the fact that you say the vibration of it, which is really a unique term that no one's used before, and I think that's actually brilliant, brilliant term. And in a way, it sounds like this is going to bring us together more because we have to be more aware of each other.
I mean, I think so. I think it already has in so many ways. I don't know about you, but I live in an urban environment. I live in Washington, D.C., and one of the first Black middle-class neighborhoods to spring up in Washington, D.C. well over 100 years ago. It's a neighborhood that's seen a lot of transition, but it's extremely diverse and predominantly Black. And I've never felt more connected to my neighbors. You know, in the evening, everybody goes out onto their stoop. The neighborhood listservs are super active. People are supporting one another. They're showing up for one another. I was just responding to a post about a refrigerator. They're trying to place refrigerators outside of different local businesses that agree to keep free food, to be able to provide a food pantry for those in need. There's a Thai place right outside of my house that has had a chalkboard sign since the beginning of quarantine that says, "If we're hungry, we will feed you." And I had felt as though the movement was sort of going in the other way within my own neighborhood. Having lived here for about 6 or 7 years now, I felt an increasing loss of a sense of community. And now with COVID-19, I feel that sense of community restored. I could say the same thing though for my business. You know, we at IWBI, we produce regular webcasts. We have for quite some time. When the pandemic started, our webcast attendance jumped from a couple hundred to a couple thousand people for each session. I think people are craving that kind of community, and especially in the absence of physical contact, we're finding other ways to hold ourselves together. And I know that's another COVID silver lining that we've talked about a lot within our own organization. We've never felt so close and so connected, though we may be far apart.
Yeah, it's so true. I've even noticed that people are realizing, because they missed the social close interaction, we're actually connecting more authentically through technology now than we did before, even to the point, I know a lot of people like to use the Zoom background, but I don't want people to use the Zoom background because I wouldn't have seen the art behind you. And that's where people feel literally more connected and more interested in each other. So I think you're right on the money, and kind of segue into an overlap a little bit. What role do you think then business leaders who care, which you're trying to recognize, will play for their town, but with respect to 3 key aspects of well-being: their financial well-being, their physical well-being, and their mental well-being? How are they going to handle that and realize that it is good for business and also important for community?
Well, I think that the best organizations are really going to look comprehensively across themes of preparedness and prevention, resilience and recovery. I think that we all realize that our ability to survive and thrive in the time of the pandemic at an organizational scale had a lot to do with the trust, the confidence, and the culture that we had banked prior to the pandemic. But it's never too late for us to start. So the best organizations are taking a comprehensive approach to thinking about health and well-being. There's a kind of triage that we talk about with a lot of the organizations that we partner with many of which are the largest businesses in the world, but some of which are, schools in semi-rural communities in Ohio, or YMCAs that cater to a whole host of different community members across a whole massive span of daily activities. So I think that, each of those organizations, at least the ones that are taking this the most seriously, are going, okay, first we've got to tend to the immediate. The immediate is staunching the bleeding. So the immediate is what are we going to do to adapt our practices, our protocols, all the stuff that you're hearing in the media about PPE and physical distancing, and is it 6 feet apart or 8 feet apart? That's number one. And then the second phase, or the second sort of bucket of triage that you're looking at, is, okay, so what are some of the medium-term efforts that might involve, for instance, deeper facilities improvements, upgraded technologies to allow for things like better information and data and analytics to be able to track outbreaks, for instance. And then that third, bucket is really long-range thinking, an organization asking itself, what can I do to actually address the long-term preventable diseases that show up as preconditions for COVID-19, but also so many other conditions as well. So what are my obligations to my employee relative to, supporting their mental health and mental resilience? What can I do to enhance physical health outcomes through improved nourishment and reduced sedentary behavior? So I think the most progressive employers around this topic of mental health and well-being have said, okay, we get it. This has a huge impact on our bottom line. If we can reduce the number of sick days on average by 1 day, if we can, improve productivity by 1%, that has enormous implications for my business's productivity and for the success of my business financially. So applying these different strategies is not altruistic. Right now, I think more and more employers aren't saying, should I do these things? They're just saying, which of these things should I do first? And then how will I exercise these broader commitments to health and well-being into the long term? And I think our system, really helps with that effort, helps as a kind of roadmap for the wayfinding for building owners, operators, and leadership within organizations. And that health safety rating is designed to really address that very first phase of triage. What do I need to do now, so that when it's time to bring people back into our spaces, they perceive that I have done the right things, that I have been through a validation process to prove it, and that I've taken all of the precautions possible to attempt to protect their health in a moment when perhaps the risk of the virus is still elevated, or maybe it's not, but I perceive it to be. Because right now in our communal and public and private, spaces where we've historically gone to congregate, perception is about as important as reality.
Well, I guess the best way I can answer that is well done. No, you're a star. You've always been a star in leading this effort, and I think we're finally getting to the point that leaders really do care and realize they need to care, about all this. And so, thanks a million for joining us.
Thank you for having me. I think it's just an uncertain time, but there are many silver linings that we find even in these darkest of clouds. And what makes me the most optimistic is a generation of leaders who care, that I think that we're in the process of bringing up right now, right down to some of the youngest people in my life who, even at the ages of 4, 5, and 6, can start to articulate how this experience is changing them. But what we know is that the great generation didn't become the great generation until they survived those first phases of hardship in their lives. And so I'm more optimistic than ever about the coming up of leaders within our organizations and within our communities, and what we're going to do to sustain them and bolster them in their own successes. So good to know that you all are a part of that effort in cultivating the Leaders Who Care platform. Thank you.